Cancers. Answers. Put them together and you get Cancers, a Kimmel Cancer Center series intended to introduce the doctors, scientists, and nurses of Johns Hopkins who work every day in the battle against cancer. Cancers. Meet the experts.
Lung cancer remains the deadliest of all cancers in both men and women. It's one of the most common cancers in the U.S. and tough to beat, but it's also one of the first cancers to benefit from new drugs that target genetic differences in cancer cells while sparing healthy cells that don't show those differences. I'm Charles Rudin, a lung cancer specialist here at the Kimmel Cancer Center at Johns Hopkins. Each cell in our body contains a set of genetic instructions that determines eye color, the color of our hair, or the shape of our ears. The genetic instructions in cancer cells contain mistakes or mutations. Those instructions send messages to the cells to grow and divide out of control. Every person with cancer has a unique set of these mutations that contributes to their disease. Lung cancer patients here at Johns Hopkins are tested to find out what mutations exist in their tumors. About 10% of patients with the most common form of lung cancer, called non-small cell lung cancer, have a specific genetic mutation called EGFR. We have a widely available drug called erlotinib that zeroes in on this mutation and kills the lung cancer cells. We're always looking for new drugs that will block the mutations of these runaway genes, and that's where clinical trials play a big role in treating lung cancer. Our specialists test patients for these mutations and then evaluate their eligibility for clinical trials of those drugs. And with the help of Johns Hopkins researchers who linked a pathway in the body to how cancer cells communicate with each other, scientists are testing drugs that interfere with this crosstalk. Location and appearance under the microscope used to be the guidelines on how we treated a patient's cancer. No more. It's clear that cancer's genetic footprint may be a new way to guide us in choosing the right therapy for the specific patient at the time of diagnosis.